Thank you so much for everybody who's staying late. We've got the long haulers here, so that's awesome. We really appreciate it. Just to make sure you're in the right session, this is promoting well-being and mitigating burnout in the telehealth provider. My name is Laura Oaktie. I'm going to be the the in-person moderator, and Rhonda Jackson is our virtual moderator. So those online, feel free to reach out with her if you have any issues. If you don't have time to get to your questions, please feel free to access our speakers afterwards and through the app. But in the meantime, if you're like me, when I have questions, it's like right there in my head and then I lose it. So please go ahead and log into the session and use the Q&A that's in there that you can go ahead and do that. And our virtual people, please feel free to use that as well. But I will go ahead and let our presenters introduce themselves, but we have the very gifted Dr. Atanda and Gustin and Hagel with us, so we are very fortunate to have their expertise, and I will stop talking to let them go ahead and have the time to be able to brighten your minds. Thank you so much.
Good morning, everybody. Welcome. So as Laura mentioned, I'm Alfred Atanda. I am a pediatric orthopedic surgeon, sports medicine specialist at Nemours Children's Health, and I also spend 20% of my time devoted to the clinicians and physicians of our hospital as the Director of Clinician Wellbeing. Dr. Tina Gustin is here as well with us. She's an associate professor at ODU nearby. And Lauren Hagel is a doctor of physical therapy and orthopedic clinical specialist. So burnout, it's a big topic. When I was coming up in the ranks in surgical training, it was kind of a bad word. Nobody really talked about it, just swept it under the rug, but I'm sure we were all experiencing various levels of it. The specific definition is really a combination between emotional and physical exhaustion, as well as a sense of depersonalization or being detached from the patients and the folks that you're taking care of, as well as this lower sense of accomplishment and achievement. I always tell people that it's an occupational hazard. Just like when I'm in the operating room and I get stabbed with a drill or cut by a scalpel, burnout is an occupational hazard that is a system level problem. It is not an individual level problem. Obviously, there are individual things that you can do to try to combat and mitigate burnout, but let's be clear that it's a combination of systemic and environmental factors that manifest in individuals. Now, there's a lot of drivers of burnout that we talk about. You can obviously see them there up on the slide. A lot of it has to do with excessive workloads, inefficient processes, lack of appropriate autonomy and flexibility, moral distress, second victim syndrome we talk about, poor work-life balance and integration. And when you think of the consequences of burnout, historically, personal ramifications of burnout, so issues with broken relationships, alcohol and substance abuse, depression, unfortunately suicide. And as we've been kind of talking about those topics, it hasn't gained a lot of attention until we've talked about the professional and financial ramifications of burnout. And it is unfortunate that it takes finances and large organizational decisions to help understand burnout and do something about it. But we definitely know that it leads to increased medical errors, poor quality of care, poor patient satisfaction, decreased productivity and professional effort. And this idea of physician and clinician turnover, at least in our world, for your average physician, it's anywhere between $500,000 and $1 million to replace a physician that has left due to burnout and other issues. So we just wanted to give you a little bit of a framework of the background of burnout, but obviously this is a telemedicine conference. And as I've said, I've done a lot of work with physicians and clinicians in general, but there's a whole subset of issues that are unique to our virtual, digital, and telehealth providers, and that's really what we want to get into today for you.
I'm very happy to be with you today. I'm Dr. Tina Gustin, and just a little bit about me. I am an associate professor at Old Dominion University, which is right around the corner from us. I'm the co-director for our Center for Telehealth Innovation, Education, and Research. And I'm also the clinical manager for telehealth at, right around the corner, the Children's Hospital of the King's Daughters. And I think that that background is relevant to you because I work with clinicians, but I'm also teaching new providers and students on how to do telehealth. And one of the things that I have found interesting up until recently, we haven't even talked about burnout or Zoom fatigue in the telehealth world. For some of you guys know me, and about 5 years ago, I really started talking about telehealth etiquette. And that was kind of a new word in telehealth space. And we then started teaching telehealth etiquette and really pushed how do you do a good visit. Well, I've been pondering this a lot in the last several weeks and have realized that telehealth etiquette has actually added to the burnout because we have to think about how we do a visit, right? We have to think about being different than an in-person visit. And where are we today? I think this telehealth burnout is the new phrase that we need to now take back to education and to new providers and to providers learning how to do telehealth and back to those of you who have been practicing. So the model that you see in front of us was developed by my colleague, Dr. Carolyn Rutledge, who, shout out to her, was going to be here today, but had a family emergency, so I'm here in her place. And she developed this model several months ago. And if you look at it, it's the constructs of what's creating your burnout when you are in a telehealth environment. And we're going to talk a little bit more of each as we go through the next slides. We have physical burnout. What does that mean? How many of you sit and do your telehealth visits? I'm going to make y'all interact with me. Okay, do any of you stand for your telehealth visits? Okay, we have a few. Do any of you get up in between visits and move around? Raise your hand. 2, only 2. Then we think about the emotional stress. I love the lecture I just came from where we were talking about behavioral health and managing emergencies. And I left that lecture emotionally stressed, thinking about, oh my gosh, how do you manage that? So that's the emotional and mental unrest that comes with these unique visits that we're doing. Then we have equipment. How many people in here are stressed regularly from your equipment? Equipment failures, equipment, too much equipment, okay? Different from an in-person physical visit, correct? Visual. How many people think they are becoming burned out or stressed just from eye strain? I got 2. And then external. And external is our legal, our reimbursement, and issues that really are beyond our control, are they not? Do they stress you? Got one big hand. Okay. So let's move on to things that you do know, but I think it's worth sitting on for a minute. So emotional and mental and cognitive stress. We all know what that is, don't we? So think about the cognitive overload. Let's sit on that bullet for just a minute. The cognitive overload of conducting back-to-back-to-back telehealth visits. Think about that. Does that affect your burnout? Think about specifically the low morale or withdrawal or emotional exhaustion. Kind of go through this list and think in your mind, do I have any of these feelings? Am I irritable? Has my workload created an irritability in me? Do I have, because of back-to-back-to-back-to-back visits, do I have less of a feeling of well-being about myself and my workspace? I'm intrigued since COVID, and I call it the light switch. You probably all do. You know, people that were thinking about doing telehealth suddenly started doing it because they had to sustain their practice. What happened to you when you were doing visits all day long that you had not done virtually all day long before? Looking at the bullet, raise your hand if you have any of these feelings as a result of regular visits. Emotional exhaustion, decreased productivity, how does that affect your practice? Got one. So what are we going to do about that? So I think that's the most important thing. We all know what it feels like, but what can we do? Some of the suggestions are scheduling your telehealth visits separate from regular visits. So what I mean by that is maybe not blocks of telehealth visits, but an in-person and then a telehealth and an in-person and a telehealth. So when I go out to my practices at CHKD, the Children's Hospital, I usually ask the practice managers and the staff, what's your flow of the day? You know, how do you schedule your day? And is it easier for you, the provider, to do all of your telehealth visits on a Friday, or perhaps one telehealth visit in the morning, one in the afternoon? So realize these are practices that aren't fully telehealth integrated. You know, so think about what is best for you as a provider and what is best for you as a practice. Seeking social connection. Let's go back in our minds of what it was like when we were fully in person and not telehealth. You would walk out of a room. What did you do? You walked out of a room seeing a patient or a client. You saw a staff member in the hallway. You talked to them for a little while. You maybe got a drink at the water fountain. You might have made a phone call. You answered a page, and then you went into the next room. Is that happening in a fully integrated telehealth model? It's not. So that social connection is critical, and we need to make sure that it's built into your day to prevent some of your burnout. The pause, the 40-second pause. Anybody in here work in critical care, ICUs? You know the 60-second pause? That is now pretty large in critical care medicine. And there's really not an analogy, but what we're trying to build in is a pause between visits. The 60-second pause is after a critical incident in an ICU. All of the staff stops. They take 60 seconds to reflect on that experience. They support each other, and then they move to the next event. And what we're beginning to realize is you need a 40-second, 60-second pause between these visits to reflect on how that visit ran for you. Was it hard? Did anything trigger you? Were you sad? Are you exhausted? To give yourself 40 seconds to just reflect, to then move to the next visit. And then set your personal expectations and rules. You know, be intentional. This is hard, and I think this is one of the harder things for me, especially in academia, is to separate your work from your home. You know, if you are working at your home doing your virtual visits, it's hard, is it not? You know, and some of the suggestions are to block time periods between your professional time and your personal time. Make time for vacations and breaks. Have a separate designated space for work. And I've talked to, so Amanda here, we'll talk a little bit about her in a minute. One of her suggestions, which I thought was brilliant, is you have a computer where you do maybe your school or your personal, but then have a designated space just for your telehealth. So maybe 2 offices if you're able to do that, if you're at your home. And when I've gone into practices at CHKD and they're like, well, we got a laptop and we're gonna go here and we're gonna go there and we're gonna put it here. How many of you work in a practice like that? It's all over the place. So if you can have a designated space, it's gonna help you with this burnout. And then don't multitask. I'm the worst at that, personally. Equipment stress. Who's stressed by their equipment? It's too much new technology. We've seen technology here, technology that doesn't meet your needs. So my question is you as the provider, did you get to pick that technology or did somebody else pick it for you? So be a part of that technology selection, be a part of picking it so it's 2 clicks for you and maybe 1 or 2 clicks for your patient, because on either end, it's going to add stress. Lack of proficiency, I hope all of you have been educated in how to work the equipment, but it's not just you learning how to work the equipment. We've heard a lot about it at this conference, teaching your patients how to work the technology. If your patient doesn't know how to sign on the other end, what happens to you as a provider with your stress and burnout? It's awful. Your stress then goes up and you enter that visit into being stressed. So take the time to have somebody in your practice train these patients and clients in how to get in. Technology that's not functioning well, technology that's fragmented, lack of connectivity and duplication of information. I'm going to tell you a quick story. I implemented an RPM project over at the hospital right at the start of COVID. It was a great project. It was delivering RPM to patients that were homebound with hospice and palliative care children. And what happened, though, however, was while the data could have dumped into the EHR, our IT made the decision not to dump it into the EHR because it was too hard for them. So what do you think that did to the provider, into the nurse who was reading the data? That nurse had to manually enter into the EHR. It didn't go to all the providers throughout the system. It was a one-year project, and at the end of the year, they didn't buy the equipment. Why did they not buy the equipment? Because it burned people out, because it was too cumbersome. So good things are not going to happen if our providers are getting burned out from it. And the lack of duplication of information, that project alone demonstrated duplication of information that burned out the nurse, the provider, and the practice manager. So strategies for equipment stress, or reducing it: select your equipment carefully, be involved in it. Don't let somebody else make that decision, and then pull the IT person in who really doesn't know what's going, truly, they know their end. So they need to be educated on how this equipment affects them. Take the time, or take the time to do that. We need to have training for our equipment. And when I think about training, there was a poster yesterday that was brilliant on training for providers. My training for new educators and for new students is long. It's a 2-week CEU credit, raise your hand, a 2-week CEU course that is meant for new people. Providers don't have time to do that. We can't stress providers out with education. So give them a very short educational snippet so they understand the equipment and they understand how to use it and they understand how to troubleshoot. I loved that topic that you have. That's new. We're not teaching people how to manage all the problems. Check your equipment prior to a visit. I think we're past this stage, but several years ago, I had a lot of providers that had sticky notes over their camera because they were afraid of HIPAA and being MyHC heads, and then they're calling, I can't get into that, I can't get in. So they're going to abandon. They're burned out, they don't like it, they'll never do it. And it was a silly sticky note over the camera. We need to streamline the technologies, we need to streamline the processes, and the only way to do that is for you to be involved in it. You probably most of us don't like policy development, we don't like protocols, but if you don't do the policy and you don't do the protocols, who's going to do it for you? The practice manager, right? And what is the practice manager? Do I have practice managers in here? Do I have leadership in here? See, they're not here. They don't care about your burnout. Yeah, I've got one. Most don't care about the burnout. What do they care about? You care about the dollar, right? And to get the dollar, you're going to not buy expensive equipment and you're going to have appointments back to back to back. You have to be involved in this process. Visual stress, that's a big one as well. Who in here has the blue glasses? Anybody? So I've got a couple. Okay. Who in here has dry eyes? How much does this affect your dry eyes and your strain to your eyes? 60% of Americans have some sort of digital eye strain. I am surprised that we only maybe had 20% raise your hands. You don't even know you have digital eye strain, I would imagine. It creates fatigue. It creates an inability to focus, which then decreases your activity. So it creates the dry eye, it creates the overload, the close-up screens we have. And I love this last bullet, it increases self-evaluation. So let's pause on that for just a second. I have a friend who is a plastic surgeon, and do you know that plastic surgery from neck up has gone up by about 70% in the last 3 years? You aware of that? Do you know why? It is pretty stinking hard to look at yourself all day long, 1 foot away from the camera, and everything's exaggerated. Does that not cause some element of stress? I think I look pretty good until I look in a Zoom meeting, and I'm like, ooh, girlfriend, you're looking rough today. And seriously, it has increased Plastic surgery, it's increased personal stress and anxiety, and it's a real thing. So what are your strategies beyond plastic surgery? So one is to increase the size of your patient onto the full screen, so that they're easier to see. And then, although in my telehealth etiquette, what do I teach you? You take the patient, you make them little, and you put them underneath your camera, right? So they're little tiny squares, so you're looking at them and not yourself. So it's an oxymoron of some of the things that can help us. Increase the font, artificial tears for those of us who have dry eyes. We're probably already doing it. And for the 60% in the room who don't think you have eye strain, I would encourage you to begin using artificial tears. Wear your blue blocker glasses. You can get them for $17. If you don't wear correctional lenses, you can get them for $17 on Amazon. It's worth it. It really is. And for those of us who have correctional lenses, I have my blue blocker lenses sitting next to my computer when I'm going to do regular Zoom visits and tele visits. Decrease your overhead lighting. Keep your screen about an arm's length. And the 20/20 rule. Who practices the 20/20 rule? Do you know what it is? Take this one home with you. So for every 20 minutes, look away for 20 seconds and then focus on something 20 feet away. Put that on a sticky note, put it on your calendar, and begin to practice that. It will really, truly help you with eye strain. So our external stress, and we're going to sit on external stress I'm going to talk a little bit more about it when we get to the poster. The external stress is your personal workspace, and it's where you're working to deliver, your harmony, but also the workflow and the billing and the legal. Does it stress you out? Do you know the legal? Do you know the billing? I've really paid attention at this conference, and I've listened to people stressing out over legal. I teach legal and policy in my class, and I have to change that silly little PowerPoint every 2 months because it changes every 2 months. And then I listened to 2 attorneys standing here talking before our presentation, and they were saying, well, we really don't know. Well, if they really don't know because it's changing so rapidly, how the heck are we supposed to know? And I think 3 years ago, we lived in that space of you don't know what you don't know, right? So when you don't know what you don't know, it's a pretty comfortable place to live in. You're not burned out and you're not stressed. But now most of us know what we don't know, or we know things that we should know, and we think we know, blah, 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 and it's creating an external stress. Raise your hand if that is creating an external stress for you. It absolutely is. So we're living in a new space. So what are we going to do? Training. I talked about telehealth etiquette. We've been training telehealth etiquette now, but I think the telehealth etiquette, quite frankly, is causing telehealth fatigue. Conducting physical exams without peripherals and teaching people how to do that so they're comfortable with it. When I go into these new practices and I'm telling them they can assess belly pain without a stethoscope or putting their hands on a patient, it's like, and so it does create an element of stress and burnout until they become comfortable. Providing education and learning styles. We don't all learn the same way. And empathy. Is empathy a harder thing to do virtually? Is it harder? Is it more intentional? And if it's more intentional, what does that require from you? More thought. So if you have more thought to give an empathetic virtual visit, what does that do to you? You have cognitive exhaustion. So I want to talk just a little bit about the Zoom exhaustion fatigue scale. I would love to know if anybody in this room took this survey for our student last year. Anybody? Okay. So we sent this survey. So the Zoom exhaustion fatigue scale, ZEF, is a scale that was developed really kind of at the start of COVID, looking at how Zoom was exhausting the population at large. It started with a 49-item survey. It's down to 15 now, and I'm going to read the construct so I don't get it wrong. There are 5 constructs to this survey, and it looks at your general fatigue, your visual fatigue, your social fatigue, your motivational fatigue, and you're emotional. So it's general, visual, social, motivational, and emotional. It was born out of Zoom, but it's translatable very easily over to telehealth, okay? It's all really the same. This is a reliable and valid tool. I would encourage you to utilize it. And the findings from the Zoom study showed that video conferencing produces fatigue, that it produces both somatic and cognitive exhaustion, and it creates a very tired, worried, anxiety-induced burnout, stress, and headaches. So that's Zoom. Does it feel familiar to you for telehealth? Is it going to click on me? If I just click, will it come? Just click here. Magic! So this is the poster that some of you may have seen yesterday. It's Amanda Hudgens, who will be Dr. Hudgens in May, and she studied providers and evaluated their ZEF scores with regards to telehealth. So a couple things that are interesting with this, if you didn't see her poster. It went out to people that are part of CTEL, it went out to people that are part of Matrix, and it went out to nurse practitioners. She got back predominantly nurse practitioners evaluating the survey. Maybe as more nurse practitioners are doing telehealth, or just more friendly with regards to surveys, not sure. But she has a fairly large sample size, and what she found was interesting. So let's sit on this for a minute. Amanda really thought that if you practiced self-care at home and in your personal world, that it would translate over to your work world and would thereby decrease your Zoom fatigue or your telehealth fatigue. Interestingly, it didn't. Most of the providers practice some sort of resiliency in their personal world. Most exhibited exhaustion from their telehealth. And there are two things that created the greatest amount of exhaustion. One, the time between the back-to-back visits, and then the time between the visits. Who controls in your world back-to-back visits and time between visits? Say it. Admin. Admin. So there's a lack of control in this environment, and if those are the two things that affected the greatest amount of stress, are they not things that can be controlled? So I would encourage you to talk to Amanda after this talk. So, and with that, we're going to move into physical stress.
All right, hello, I'm Lauren. I'm a physical therapist, and I'm currently practicing in Manhattan for a major hospital system, but my background was working in private practice, orthopedic sports medicine, and my passion's really there, where I got to work with a lot of youth and fell in love with telehealth while working with pediatrics. So I get the honor of discussing these very uplifting components of pain, stiffness, and weight gain with you all. But the good news is we'll also talk about a lot of great strategies to combat those things. I'm sure you all have experienced pain at some point in your life, and probably related to sitting at the computer. Raise your hand if you've had any pain or stiffness from this. Okay, that's the most hands I've seen the entire morning, so we can all relate. There's certainly very many types of pain. Musculoskeletal, kind of a common type that you might think of with the muscle tension, spasms, things like that. There's also neurological pain like sciatic pain, irritation. The sciatic nerve is pretty touchy. It does not like you sitting on your bum all day, so that's not great for it. Radicular pain from your neck, carpal tunnel, all these things can be exacerbated from sitting, using a computer. The rest of the world that maybe weren't clinicians have probably dealt with this for a while, but those of us that have transitioned to working at a desk more are now starting to deal with this as well. Stiffness in the joints, weight gain, we're not as mobile. Tina touched on that. So these long periods of sitting certainly contribute to that. We're not burning as many calories. We're not getting that blood flowing, and our posture certainly isn't helping the way we feel as well. So let's talk about what to do. A huge part is ergonomics. And we toss that term around a lot, but I can tell you from my own practice, being in a variety of different physical therapy settings, the ergonomic setup that we've had available from our administration is usually trash. So I can only imagine what everyone else's offices are like. I feel like it's very hypocritical for people in the musculoskeletal field not to even have that type of setup. So these things there's a couple staples that I'd say are important for everyone to abide by, but these things are helpful to consider on a case-by-case basis. Of course, everyone has a slightly different setup. But the staples are having, one, the screen at eye level so that your neck is not too far up or down. Two, having your hands nice and low and relaxed so that your shoulders are at ease and not elevated and tense. And then three, making sure that your feet are comfortably on the floor. For those people that are nice and petite, if you have a high chair and you can't adjust it, it can actually cause some strain on the back. And there's some simple solutions that everybody can implement to make a big change. So for those feet, obviously propping up on something. And then for the screen, the height of it, it's really hard to get that right with a laptop because your hands are up high if your screen's right. So my favorite thing to recommend is external keyboards. These are amazing. I'm sure I see a lot of you shaking your heads. Big fans, love that. So you can always just use an easy hack, prop your laptop up on some books or get a nice, more professional looking riser if you want, and then have the external keyboard at the height that you like. If your desk is too high still, there are alternatives, installing a lower drawer shelf that you can have to pull out the keyboard, play around with the height of the chair as well relative to the computer. So there's a ton we could talk about, probably an entire session on ergonomics and specific solutions. I love this topic, but we'll move on. So the next thing being movement. Move every chance you can get really is the answer, but move every hour in between sessions. I concur completely that that little break in between your visits would make so much of a difference, not only mentally, cognitively, but physically. This is something that might be a hard sell, but hopefully with more data and research like Amanda has, if that could be brought to the administrators, maybe that can help start, moving the needle a little bit. And yeah, so get up, walk around, try to simulate what it would have been like if you had an in-person session where you would go to another room or greet the next person, get a cup of water, go to the bathroom, things like that. Just try to envision your workflow and not lose as much sight of that, because it's easy to just get zoned in and just sit. So the other parts of this slide is talking about planning walks, planning exercise, planning healthy meals. And the key here is plan, because I know for me, if I don't plan it in my day, it literally won't happen. And I'm a morning girl, so I like to do it in the beginning. But if you are, let's say your telehealth is in an office, maybe you're not working from home, maybe that's harder to manage, maybe at lunch. Or I used to do something with my coworkers, I called it push-up club. Every mid-afternoon, same time, same place, we all met. I don't care if you're on your knees, full push-up, 2 push-ups, 20, 50, we all did what we could do. And it was super fun. We all had like a rush of good endorphins afterwards. Everyone was smiling more, feeling brighter. So I really encourage trying to think of exercises that you could even do in your office, especially if you're not at home, that might only take a couple seconds, whether that's just pulling your shoulders back, simulating a row, raising your arms up. Overhead stuff is great because we're in these kind of like forward positions, right? So anything that promotes extension of the spine, opening, things that are going to get the posterior chain muscles going is going to be great. So really tapping into those strategies is a big deal, and you can always talk to your physical therapist if you have any available for ideas. There's a lot of nerve glides that you can do if you're getting carpal tunnel and things like that. So and yes, the healthy meals is big because it is a lot easier to just like grab a bag of chips when you're sitting at the desk And for me, when I'm at a desk, I'm thinking more about what I want to eat next versus when I'm in a clinic, I'm walking around, it feels like an activity, I'm not thinking about it. So these things are real, and I think a lot of bad habits have been developed during telehealth. So hopefully we can all just be more conscious and plan, maybe use that time if you are working from home, you did, a longer commute to work in the past, maybe use that time for your meal prep. So there's ways you can actually get a few things back. So with the workspace, certainly creating a nice, tranquil environment is key. And I think of what this embodies is a part of setting boundaries. Just because you don't have a client in your office or in your space doesn't mean you don't deserve to have the privacy, have the door closed, and the motif be nice and streamlined. Certainly you don't want to have tic-tacky things, we all know that, but just making it visually feel calm so that nothing within your control is adding to your burnout. There's a lot of variables, we've discussed we can't control that maybe administration holds, the power with, but if you can make a change, definitely that's where we want to give you some easy ones. Certainly good lighting, connectivity. With the lighting, I just want to say that forget the plastic surgery, get a ring light. That will take years off your life, off your face. So big fan. You can get all sorts of, color settings. It's beautiful. All right, so for more of the operations and team construct of the workplace, we still deal with that during telehealth, right? It hasn't gone away, and there's certain aspects of it that are more influential when it's telehealth compared to maybe how you used to do your business. So just to touch on those here, you still want to really listen to your coworkers, your team on the concerns and your clients and bring that back to management. Really advocate for proper training. If you're feeling like you're not comfortable with how the expectations are, what the billing is, things like that, those are really valid concerns to bring up. When we've all transitioned, like Tina said, we didn't really know at first what to do, but now that we're starting to have more and more understanding of how big a responsibility this is, we need to make sure that we're very clear on it. We don't want to have that add to our stress and burnout. The next thing is, one of my favorite parts of this slide is providing praise, rewards, incentives. I think that is easily lost in telehealth because we're a little bit more siloed, and we're not having that team experience or the praise. We already know we're in a thankless job a lot of times, and then this adding on top of it can be brutal. So one little idea I have that I've experienced in my workplace is receiving e-cards or sending e-cards to acknowledge or thank another colleague. I've gotten them for putting on a workshop or going the extra mile for a patient, and honestly it makes me feel really good. And there's fun little graphics, and I've been able to send them, and people have told me it made their entire week. So there's all sorts of ways you can even incorporate these digital solutions while you're working more digitally and still make people feel seen and appreciated and like there's a lot of meaning in what they're doing. Of course, don't add responsibilities without taking away, and then track your trends. Tina's team has done so much great research and really trying to consider what it is that's a problem and what we can do better. So I definitely encourage continued focus on that so we can keep innovating and keep growing, making changes, solving problems and things like that. And then if you are doing a hybrid model, of course, scheduling more intentionally around maybe when your telehealth is working best in your schedule versus when you're in person. And then lastly, just want to make sure that you're having touch points with your colleagues, I think, and collaborating on what the expectations are, how you guys are enforcing your policies, all these things to keep the workflow going, you feeling comfortable. There's definitely ways that you can make more creative solutions too to kind of break up your day, whether you want to do a quicker session option for patients, if it's a quick vitals check or things like that. You can do 15-minute sessions. It doesn't have to all be one bulk thing. So hopefully you guys can think outside of the box. I'm sure you already are. But and then there's a ton of different technologies that you can do for integration. I know a lot of the sessions here have talked about that, and hopefully we can keep streamlining, but I do think that could eliminate some of these peripheral stressors in terms of reducing our burnout as well. So,
Thanks, guys. Listening to Tina and Lauren talks really put a lot of things in perspective for me. As an orthopedic surgeon, about 7 or 8 years ago when I got into telehealth, a lot of my partners and the administrators specifically thought I was crazy, right? Because I'm a bone surgeon and I need to touch people and all this sort of stuff. And they finally realized that telehealth can be a great tool to help augment the in-person care that we're providing. And now in my partial role as the director of clinician well-being for my hospital, I'm fighting that battle again, because it's like, well, why do you even pay attention to the burnout that people are feeling? Just sweep it under the rug, keep moving, keep seeing your patients. And then the whole subset of that is for folks that are specifically doing a lot of digital work. So I keep thinking it's like Groundhog Day. I keep waking up and having new battles to fight, but this has been a very insightful talk in session. And again, just to reiterate, burnout is a workplace occupational hazard, again, that's manifested in individuals, right? We've talked a lot about things that you yourselves as individuals can do to make your situation better, but ultimately it's up to the system to do a lot of the heavy lifting. Again, you can rearrange your workspace, you can get up and take a break, you can do exercising, but you can't change, external regulatory pressures. You can't change the guidelines. Sometimes it's an act of Congress just to adjust your template and look at the amount of time per patient and the amount of time in between patients. And that's where people like myself, who have dedicated time to do this clinician well-being work and burnout work, need to kind of step up their game. So I think this symposium gives you a lot of tools and a lot of ammunition to do what you can do for yourself, but also to take back to those that are powers that be, to make it, make them aware of what they really need to be doing. And again, we've tended to focus on burnout in the traditional in-person provider setting, but hopefully this session has really brought some awareness that there's a lot of things that are unique to digital health and telehealth providers. And again, we really have to be the spokespeople for this, right? We have to be vigilant, not just about bringing telehealth and increasing access to care. That's great, obviously, but as providers doing the telehealth and providing the care, we have to be vigilant about what are those particular drivers of burnout. What are those things that are within our grasp, within our control? What are those things that we need to kind of delegate to the C-suite level individuals and the leaders to help take that burden off of us? Because it's really challenging and taxing to do God's work the way we do it and take care of other human beings and really support them through their journey of whatever medical problem they're facing. But then to deal with all the kind of external pressures and regulatory issues and administrative stuff we talked about, sometimes it's just too much. So I think that's all we have for today. We have probably about 16 minutes or so for questions and discussion. I really appreciate everybody's time and presence here today. Thank you.
Okay, that was absolutely wonderful. This is a good holdout for the end of the day. We do have one more session, so don't forget, we do have the keynote on AI to go after this, but fortunately, we do have plenty of time to ask questions. I just want to ask, how many of you, when Lauren started talking about how you were sitting, were just like sort of adjusting, like, ooh, I forgot, I'm supposed to pay attention to that. So definitely, we'll do some in-person questions. If you're going to respond to that question as a speaker, if you could repeat the question for our online people, and then we'll go to the Q&A, and then we'll, if we have time after that, go to the virtual teams to see if we have questions there. So, oh, and one thing I just wanted to add that didn't get touched on that I'm a big fan of is breathing techniques. So 478, if you haven't heard of that, just research it and looked it up, but those are really awesome techniques. So I'm going to leave it to any questions internal. Yeah, go ahead.
I don't have a question. I just wanted to add something to Laura and to Tina's point regarding the computer and
for sharing that.
Okay, for those who missed that, online, we were talking about the eye level is the key. Very good. Yeah, I was trying to take it off, but
And also,
good job.
just while I have everyone's attention, I do have the Zoom exhaustion scale QR code up here, so I'm gonna leave it up here on the desk, so if you guys, or I can pass it around. If you guys wanna take a picture, and do the actual test, it gives you a nice printout of your percentage of Zoom fatigue. You just go. I'm sorry, I don't mean to be taking over. Yeah, I'm sorry. So, the Zoom exhaustion and fatigue score or scale, I'm going to pass the QR code around, and can we put that online for the participants some way? Okay, and so if you take that, it gives you a nice printout of your total Zoom exhaustion and fatigue scale score, which would, in our world, equal synchronous telehealth fatigue. And also, it gives you the percentages of the constructs, so those general fatigue, emotional fatigue, visual fatigue, and so on. I didn't mean to steal your thunder, thank you.
So for those of you who are online, Amanda was talking about the ZEF, the Zoom fatigue scale, and she's passing around the QR code. And one of the things, you can find it online very easily. I would encourage you not only to take it yourself, but for those of you who are working in a practice setting or maybe a practice manager, have all of the providers take that to determine really kind of where everybody sits and how you might be able to adapt your practice setting based upon how they're scoring objectively.
I would also like to add just one thing too, related to the eye level screen. Another area of pain we didn't get into. Too close? Thank you. We didn't get into was headaches, and there's a lot of different types of headaches, cluster, migraine, different things, but in terms of musculoskeletal pain, they can be created from tension with the muscles and also from what we call cervicogenic headaches, being of a cervical origin, and the clinical test is to see if the head can flex forward from the top and turn. And imagine if you get into that forward head position, you're getting a lot of extension at the top of your neck and the shear forces, which is not only very uncomfortable, but that's exactly where some of these headaches can originate. So this is more than just, oh, am I comfy, cozy at the screen? There's a lot more that goes into it in terms of your health and potential further issues that develop, like headaches.
And I just wanted to add, if you haven't, for our office, we had someone come in and assess our workstations and watch people, how they work, to make sure, that they weren't doing something that was jeopardizing. And like, I am a traditional knee crosser, which is absolutely horrid, so please stop, but it's a habit, unfortunately.
Hi, Laura, right?
Lauren,
Thanks.
there's
Lauren,
Laura and
okay,
Lauren, yeah.
okay. I work with Dr. Guston and soon-to-be Dr. Hudgens, and also our behavioral health person, Grace. And my background is in health and fitness for years and years and years, until I retired from that and went into something that paid me. Anyway, that being said, I've been doing the warm-up for the past 3 years, and what I've learned about working at a computer all day long in meetings and all of that, I started noticing the pain in my neck. I started noticing my shoulders closing in. And so what I've been trying to do for myself personally is, and I'm just offering this for people, because you did touch on everything, but from my own personal reflection, really focusing on when I start to feel pain in my neck, I do the chicken thing. Mm-hmm. So that could be like the Matrix official salute when we see each other. We start doing this.
Yeah, absolutely. There are some great chin nods, chin tuck techniques that you're talking about, where once we get into that head forward position, we can combat it, tucking the chin down, bringing it back, and doing it several times can actually feel weirdly fatiguing, which is a sign that we should do it.
Yeah, exactly. Yeah. And also just opening the chest. Mm-hmm. Even if you go to your door and just lean into it a little bit, sorry. Not used to working with a microphone anymore. But all of that are easy things that you can do for yourself. But I was wondering if it would be a good idea for different practices to reach out, as you mentioned, to a physical therapist in your organization, and even maybe have some short videos created that could be, on access to everybody in the office, something that you could put together. That would be very helpful, and it's their break, but maybe it's a quick break between a meeting. But I think there's so much that can be done to help with that physical stress that we all feel.
Yeah, that's a
all of us.
phenomenal idea. I've had the opportunity to do that for other departments, and people eat it up. Everyone loves to talk about it, and it's super helpful. And like the stretch in the doorway, these are things you can do in your office or in your house. You can do the same thing in a corner of a room. You don't even have to have a door frame. The pecs open and just relax and breathe. And I'm glad, Laura, you mentioned breathing, because that's super amazing. And it's not only physiologic, it's for your psyche. Calms down the system, as we all know, activates the parasympathetic nervous system to get the diaphragmatic component in. So lots of things.
Thank you for being here. I really appreciate it.
My pleasure.
All right, we'll do a couple questions online. So Tina, you had mentioned something about the overhead lighting, and then Lauren, you also had mentioned something about some type of light.
The ring light?
A ring light. Can you elaborate on that a little bit further?
So a ring light, I think I used as kind of a catchphrase. It doesn't, technically have to be a ring, because a lot of times people use that if their phone is in it. But the concept of bright, lighting overhead. There's webcam lights as well that can go, and just it's the perfect illumination on your face. And I mean, when I look at myself, before I turn it on, I'm like, and then I turn it on, I'm like, ooh, hello.
You have to have the right ring light, though.
Yes.
I have a ring light that does not make me go ooh.
Okay.
So,
And the right light settings, there's a warm light. Sometimes it's a little too warm. So figuring out a good light that works for you
right.
is key.
And then the overhead lighting, when we're talking about the iridescent lighting, that's the lighting that's harsh on your eyes, and it affects your eye strain and the dryness to your eyes.
Just to add to that, I too often try to look nicer with other accessories and ring lights and such. One of the things for you glasswares, it's always very annoying because you can see the reflection of the ring light in your glasses. So what I usually do is it's nice to put it here because your face illuminates up, but I usually put it off to the side, or I put it up pretty high and angle it down so it still kind of shines on your face, but I just don't like looking at myself on the screen with these rings on my face. So that's a tip you can try to use also.
Oh, those are awesome. Thank you. And Lauren, what is your thoughts on standing desks and ball chairs? Can you go into that a little bit?
Absolutely. Generally positive thoughts, but the key is not staying in those positions the entire day. The problem is, if you sit too long, it's an issue, but if you stand too long, it's also an issue. So varying up is really the key. So if you love the exercise ball and it helps promote a more erect posture of your spine, fantastic. Sometimes people feel like they're really on it. Some people hate them. That's fine too. But I do like the standing options. The ball is fine if you like it, but I would maybe do a session standing and then part of a session or the next session sitting, or just try to break it up. Figure out a cadence that works for you. It might be different for everyone, but definitely love the standing concept though. So just make sure it's not too much of a good thing, but definitely good.
Emmanuel.
All right. My question is more about a hybrid working space, whereby it's not just your room or you're at home, but you're going in and you have a shared desk, or like providers, a lot of them just have desks at work, right? Like a cubicle. How do you manage that?
Well, that's just not the burnout. It's also the etiquette and the ethics. You shouldn't be providing telehealth in a space where 3 people are doing it unless it can really be a private headset, quiet visit between.
I just want to clarify my question. It's private.
Private.
Basically, it's a shared place. You can put on a sign, telemedicine progress, but you cannot sort of bring the comfort we're talking about here because it's not your space.
Correct.
It's a shared space.
It's a shared space. I understand.
Yeah.
I see that a lot in practice, truly because of space. and availability of space. And I do think that that adds to the stress of a provider. You know, they're moving from area to area that isn't their own space. And you can speak to it in your practice. Ideally, if there can be a room at a practice that is devoted to telehealth, and then you move in and out of that room, and the room is equipped by the providers in a way that they want that room equipped, and it's shared, but it's just used for telehealth. Does that answer your question? I think that decreases the provider burnout and
Yeah, I mean, I
increases
think
well-being.
that goes along the lines of kind of the administrative discussions. You know, as providers, oftentimes administrators bring to us and say, hey, we have a telehealth capability, an area for you to do it. And then you do it, and it's not really ideally equipped to do it. You don't have the necessary software and technology, and then multiple people are utilizing it. You should really enter a workspace and have it be turnkey to how you want to provide care digitally, and it should be something with your input and the other providers who may be using that space. And I think just kind of thrusting people in like a kind of one size fits all environment without the appropriate input can be very stressful, and that's part of the issues that we've been trying to combat.
I think it also adds to that multitasking. I've watched providers with a laptop sitting at a desk. We're off to the side. You know, there's a lot of movement. There's patients, there's people, there's a lot going on to the right, and they're sitting here on a laptop trying to do a visit. In the distraction alone and having to maintain that sense of focus alone creates that cognitive exhaustion.
What I've done a lot in my practice, I often, you know, if I have a full day at clinic, I often do the telehealth visits towards the end of each session. And that serves two purposes. Number one, especially at the end of the day, then my staff can leave, and they like that. And I'm still there seeing the patients. But number two, I'm by myself. Everybody's gone. If it's the morning session, you know, they leave for lunch and whatever. But the idea is that I can be in my little cubicle. Nobody's going to be knocking on the door. Nobody's going to be like, hey, Dr. Atanda, can you look at this x-ray? I have, you know, 30, 45 minutes of doing a few visits, and it's just my quiet Zen space. But it's not my house, but I've structured things. That was kind of serendipitous. I didn't really do that on purpose. I just did it at the end of sessions, and I realized it made me feel better to be able to do these telehealth visits where it's quiet, the phones aren't ringing, nobody's around. So again, there's a lot of small little changes that you can make and try to implement that can go a long way downstream for sure.
We have one more question that we have time for, and it sort of feeds off of what you were asking about in the sense online they were saying they have no control over their environment. They can't change it. You know, they don't have the ability, they're just given what they're given and they have to use it. And so they're wondering, you know, how can you truly move the needle, and suggestions on how you can recommend as employees to get leadership to give you the tools that you need.
Well, my first answer is probably not going to be one embraced by most, but I think research is important. And using that instrument to evaluate the staff to find out really what's going on. And for research like Amanda's to become larger scale, you know, it's hard to refute data. So right now, I think we need to try to sell it and pitch it and talk about it. But once we have the data, it's hard to not make change when we have data.
Yeah, I would echo that. You know, in the role of, you know, we're fortunate at Nemours that we have a chief well-being officer who's in charge of all the associates of the hospital. And then myself, I'm in charge of the well-being for the physicians, advanced practice providers and such. But not everybody has that. A lot of times you're just out there on your own. You're thrust into a particular situation. It's not ideal. Like, what do you do? And to be honest with you, I really echo Tina's point, because a lot of C-suite level individuals, they do listen to numbers. They listen to money. They listen to JCO and other external regulatory pressures, but unfortunately, they don't always listen to people. And they often view us as providers, specifically, you know, physicians and surgeons, as complaining and whining and different things, when we're really asking for just a nice environment to do our jobs. You know, so I think leveraging existing research, tips that you've learned at a place, you know, like conferences like this one, trying to find any kind of champion in your organization that will listen, ideally somebody who's a little higher up the food chain. But we do know the struggle is real. To be able to do the frontline work that's in and of itself stressful, but not really have any hope and support of people backing you up to have a great environment to do that work is hard. But I would start with data, numbers, anything that you can use to show that you may be more productive or provide better satisfaction or better outcomes, anything, if you were given X, Y, or Z. And try to start small. You know, if you go in and you ask for the moon, you're not going to get very much. But you say, hey, listen, I just saw this really cool ring light, and it'll make me feel better when I'm doing visits. It's $10 on Amazon. You know, what do you say? You know, I joke about it, but it's like those small, easy wins. A lot of times we try to hit a home run every time we get up to bat, but you can still walk or get hit by a pitch or bunt or whatever. You just got to get on base. So for those baseball fans out there.
I was just thinking something similar. If they're not going to compromise on creating separate spaces for each provider, if there's the one designated telehealth room spot, at least see if they can negotiate, well, all of the equipment within there is fully adjustable. Maybe they need to upgrade some of the chairs or features with the monitor and things like that. Like at the very minimum, maybe they could meet you in the middle, and that could be a starting point.
Awesome. Well, thank you so much. This is an
Yeah, thanks,
incredible
everyone.
session. This is great.